Hello, this is Dr. Yoko channel. I am going to introduce to you some information that doctors do not tell you in hospitals. Improvement method of chronic symptoms and chronic diseases. The method not to use medicines if possible, like nutrients and diet. As for this theme, I would like to say about the cause of chronic disease disorders were caused by chronic inflammation. I published it as a subtitle of Inflammation of the throat, the gut and the brain were causes of chronic disorders in 2019. What is the true cause and how should we treat it? So, there are various chronic conditions such as fatigue, sleepiness, headache, arthralgia, muscle ache, concentration loss, absent-mindedness, insomnia, memory loss, itching, eczema, repeated urticaria, loss of hair, restless, panic, agitated, anxiety, worry, irritation, depressed, anorexia, bulimia, doubt in the stomach, nausea, flatulence, stomach ache, constipation, and diarrhea, sputum, sense of solid in the throat, stuffy nose, aging of skin and the nail, halitosis and body odor, palpitation, blood pressure unstable, dry mouth, hands tremor, weak muscle, poor circulation, sensitive to change of surround temperature, easy to gain weight or cannot gain weight. If you have those conditions, if you go to see doctor, they say there is no abnormality on the examination, or you do not have to worry, or you do not need to do anything, and it's unnecessary worry. Or you already diagnosed as chronic disease, such as dysautonomia, manic depression, anxiety disorder, panic disorder, adjustment disorders, insomnia, obsessive compulsive disorder, autism spectrum disorder, developmental disease, ADHD, learning disorders, or chronic fatigue syndrome, or chronic pain, such as fibromyalgia, migraine, headache, dysmenorrhea, chronic cystis, a prestige of dementia, or you already said Alzheimer's disease, Parkinson's disease, autoimmune disease such as rheumatoid arthritis, reactive hypoglycemia, or you already diagnosed diabetes, or arrhythmia, hypertension, irritable bowel disease, or ulcerative colitis, Crohn's disease, atopic dermatitis, chronic urticaria, chronic sinusitis, allergic rhinitis, chronic cough, chronic postnasal catarrh, eating disorder, anorexia nervosa, or periodontal disease, dental caries, or obesity, metabolic syndrome, or fatty acid. And then you go to see, and every day you have to take medicine. Though you went to various hospitals, your condition does not improve. Finally, you are referred to the psychiatric department, and then you are prescribed psychiatric medicine or too much medicine. And then you try to find something to help you, the information, and you believe misleading health information and confused. Every disease have root cause. I think the 5 biggest root causes are: first, chronic inflammation. The locations are gut, upper respiratory tract or mouth, and skin, and brain. And the second is malnutrition. And the third is toxic substances. And the fourth, physical structure abnormality. And the fifth, stress. I made a checklist for you. Please check together. The first is bowel chronic inflammation. If you have bowel trouble such as tension, constipation, diarrhea, and discomfort of the stomach, or you have much fat around the stomach, or allergic symptoms and autoimmune disease, and you regularly eat wheat and dairy products, and you much intake of artificial additives, and you regularly use the microwave oven, or you much intake of sugar and sweets, and regularly eat margarine and cake snacks containing oil, or the repeated use antibiotics, and satisfied only when you feel full, or your mealtime is irregular, or your dinner time is always after 8 p.m., or you have trouble with dull feeling in the stomach, or dyspepsia, and you never feel hunger. The next checklist is for chronic inflammation of the upper respiratory tract and the mouth, discomfort of the throat, and the stuffy nose and the postnasal drip, and the chronic sputum and the chronic cough, whether you have sensitivity of teeth and the toothache, or the abnormality feeling of tongue, or headache, and the temporomandibular disorder, shoulder discomfort and the neck stiffness, arthralgia of hand and finger, and the mouth bleeding, and you have dry mouth, and you have much intake of sugar and sweet, and the tooth brushing is insufficient, or you do not receive a periodic medical examination of dentistry, or you have dental caries, whether you have a periodontitis or the periodontal disease, halitosis, or repeated tonsillitis or sinusitis, or you have a rhinitis and asthma since childhood, or you have inflammation of skin that is obvious, the dermatitis or other trouble of the skin, your inflammation location is skin. And the next root cause is malnutrition. Please check together. Do not eat fresh vegetables and fruit very much, or you have white spots and line in the fingernails and the brittle nails, and you take artificial additive often, meaning the much of processed food, or you are a binge eater, or your diet is unbalanced, and you eat a lot of deep fried food, and you always use the microwave oven, or your taste and the sense of smell are dull, and you always gastric acid depressant drug taken, or the antihypertensive agent, or antimicrobial agent, or the painkiller. And you have lots of bowel trouble, including flatulence, or constipation, diarrhea, or you have cavities and periodontal disease, and you eat sugar, caffeine, chilled food often. Or the next root cause may be toxic substances. Please check together. Chronic fatigue, headache, insomnia, no concentration, and muscle ache and arthralgia, stuffy nose, postnasal drop, heartburn, flatulence, constipation, diarrhea, stool smell, and you have abnormal appetite, and edematous, hard to gain weight, or you have eczema, urticaria, skin roughness, get dark circle under eyes, repeat stomatitis, halitosis. And you take medicine and processed food lot. Or you have many opportunity to touch chemical, including cosmetics, or you have already chemical sensitivity. Or the lack of exercise, lack of sleep, and no sweat. And the relationship with hazardous substances is suspected in work, and the house environment is very suspected. Or the other root cause is the abnormality of physical structure, and haliccus valgus, bunioneti, standing on tiptoes, flat feet, and the trouble of engagement of teeth, chew food on only one side, and tend to sit sideways and cross the legs in a certain direction, or the sleeping on one side, whether you have some teeth missing, and a strange walking position, and often wear the shoes that were the wrong size and shape, and the lack of exercise, keep on sitting down for a long time, always same posture, muscle weakness, or the knee osteoarthritis, scoliosis, straight neck. And stress. And this checklist is not for a physical stress, but a mental stress. Have a certain significant stress that is obvious. You often tense and irritated, or the inside of the mouth tends to be thirsty, or when you think something, feel stomach ache, dull feeling in the stomach and the heartburn. When you feel tense, flatulence, lost stools, diarrhea, or the constipation. And you have insomnia, and palpitation, sweaty hands, and inadvertent mistaken in work and family life. Whether you are pessimism or the anxiety. Whether stay up late and eat too much late at night. Whether you are not exposed to sunlight very much and inadequate exercise. And the final checklist is this: inflammation of the brain. If many things were checked in the list above and prolonged, you may have inflammation of the brain. Recently, inflammation of the brain is the cause of prolonged condition. And I talk a lot about inflammation. I will explain about what is the inflammation. Inflammation is the protective reaction to exclude something unnecessary, such as bacteria, virus, internal, external stress, such as poison and etc. And there are two mechanisms of which an inflammation is caused. So we already know that external materials such as bacteria or virus and etc. we call PAMPs, pathogen-associated molecular patterns. But recently we are getting to know already we have internal materials in body such as DAMPs, damage-associated molecular patterns. So we call this inflammation a bacterial inflammation. And also there are two types of inflammation. So as I showed before, the acute inflammation. So there are 4 signs of acute inflammation. And one is redness, one is fever, and edema, and pain. So most recover temporarily. You return to health condition when you pass the inflammation reaction peak. But recently, chronic inflammation is very important for chronic condition. So that is invisible inflammation. So we are now a new name, inflammaging. That is a combination of inflammation and aging. When acute reaction does not recover well, low-level inflammatory reaction prolonged without clear acute inflammation. The small dose inflammation can cause dysfunction of the tissue and an organic change to fibrosis in the long term. And many reports that say that chronic inflammation concerns many diseases, such as atherosclerosis, neurodegenerative disease, and sarcopenia, and malnutrition and obesity. The lifestyle-related disease such as diabetes, and Alzheimer's disease, and autoimmune disease. So there are some locations to get easy to get inflammation. So one is intestines, and one is skin, and one is around face, meaning throat, oral cavity, and the respiratory tract, and also brain and nerves. So don't forget, the best physician to cure chronic condition is yourself. And I will talk about the basic tips for curing chronic condition. The one, do not influenced by each symptoms, and please look at the root cause, as I show the checklist. And if you find the root causes, and so please remember, it is not necessarily only one cause. You have okay to have plural causes. So then start any of root cause. And please record symptoms in chronological order. I recommend the most severe condition 10, and then the no symptom is 0. So if you record your symptoms every day, and every day you don't notice your improvement, but when 1 month later, or the 1 week, or the 2 weeks later, you notice the 10 to 7 or the 6, that meaning you are now improved. Thank you for listening. Please subscribe to Dr. Yoko channel. Let's study together.